To vax or not to vax? That's a question for Phyllis Arthur. She's an infectious disease expert for BIO. With hesitancy in some communities around COVID and other vaccines, I asked her about tech innovations that could change the way some people think about getting immunized. So what kind of vaccine innovations have struck you most? What are you paying attention to?
I'm actually really excited about many of the technologies that came out of COVID. So obviously we've all talked about mRNA. Very unique technology, been in development for a little over a decade, and really has revolutionized the ability to develop vaccines for multiple different viruses very quickly. In addition, it actually is applicable to building therapies. Otherwise, there's other technologies that were older that are actually getting a reinfusion, like protein, recombinant technologies, these things we've used for vaccines in the past, but now they become more exciting and more interesting. So there's a lot happening that could lead to great vaccines in the future.
What's your advice to people who may still be hesitant?
I think the thing I've been saying to people for the last couple of years is ask the questions. And to a provider, it's okay for someone to have questions. Like, we shouldn't be defensive as vaccine advocates for someone having a perfectly legitimate question about why they should get something or why a family member should. Instead, we should listen and understand what's underneath the subtext of why someone's concerned. Is it that they had an adverse event, or they knew a family member, or is it that they think they're not at risk? Is it that they think that something's being done to them that's not fair in the healthcare system? Understanding that actually gets people to yes. And I think it's the same thing we apply to any other convincing we need to do on something.